Hello there, and welcome to Yodo. You only die once. There is no education today. Today I want to say thank you. Thank you for your support. This is the 100th video posted on this Yodo channel. The channel was started to provide support, information, and encouragement to the clinicians, providers, caregivers, loved ones, and patients with serious illness that may be facing end of life. There are so many people that have helped me with the mission of informing others. I can't thank everyone on the list, but there's a few that I must mention. I want to thank you, the viewers and the listeners, for being so supportive and kind. You have liked so many videos and shared these with others. I'm delighted at the growth of the channel. I'm really pleased with the content as well. You have helped me greatly to stay motivated and to provide the content that you need and want. I want the channel to empower through education and to be a resource for people. It's not about giving up or quitting when someone has serious illness, but it's about learning and preparing for what's ahead and how to use the time that we're given wisely and without regret. I first and foremost want to thank Dr. Lisa Tartaglia, as she shares some of the same commitments to compassion that I do. I love working with a kindred spirit, and I've admired her from the first moment that I met her. She has shared content and ideas, as well as being able to participate in some of these videos when her schedule allows. In her first video, she shared a very personal story about what brought her to palliative and hospice medicine. I am so thankful for her ongoing support of the channel. Then there's Corla Legg. I suspect that many of you know her, as she has helped a lot of you find this channel. She has shared, liked, and commented on nearly every one of my videos, and her support has been unwavering. Corla, a heartfelt thank you. Thank you also to the learners that have assisted me. Several medical students, residents, and fellows of local medical programs have assisted me by providing ideas, and some have even prepared topic content for the videos. I must thank the guest speakers that we've had the opportunity to learn from. Physician and author Corina Mueller, OBGYN and physician development coach. She's a prominent maternal fetal medicine specialist in Anchorage, Alaska. We've been given insight from Chaplain Mark Jerkowski. He provided information regarding the differences and similarities of spirituality and religiosity. His background includes being a minister for his church group and carrying those pastoral responsibilities, as well as working for a large hospital in a trauma unit and covering the needs of patients and families in an ICU setting. He worked during the Pulse nightclub tragedy here in Orlando, Florida, and has tremendous clinical experience. I'm so grateful for his presence and the talents that he brings to the table when working with patients. Dear friend and occupational therapy specialist Joanne Keckner has provided information from her discipline. She provides assistance to those with serious illness. She's highly trained and such a compassionate provider that brings a tremendous amount of expertise to the care of her patients. I have topics for each of these speakers when they're able to return to the channel to share more information with us. I remain hopeful for the future of the channel. The plan is to also provide interviews from guest speakers across many other disciplines, such as licensed clinical social worker and bereavement specialists, nursing, home aid, and there's benefit to learn the perspective of a volunteer. The LCSW, or Licensed Clinical Social Worker discipline, can not only assist patients and families with finding, accessing, and funding of resources, but helps assist the patient and family with preparation for end of life and counseling for the family after the patient has died. The medical specialty group addresses the mental health needs for the patient as well as for their loved ones. No team is complete without the presence of nursing. This might be an LPN, licensed practical nurse, but more often is a registered nurse, and sometimes we have the presence of a nurse practitioner, an advanced practice registered nurse. Learning the role of each of these providers is crucial for a better understanding of how they address the needs of the patient and their loved one. The nurses are so crucial in the care of a patient that countless times in my career I've had important information brought to my attention by a nurse. They reinforce and provide necessary education to the patient as well as the caregiver. There would also be benefit from an interview from an in-home aide as well as learning the views of a volunteer. There are plans to explain the hospice admission process from one of these providers and the responsibilities of a case manager and a team manager. I would also like to interview some of the other support staff from a hospice agency. I'm looking forward to providing the point of view of these and other disciplines. Palliative and hospice staff are truly motivated by compassion and to help others with this part of our life. It is my goal for you to hear information from each of these disciplines in the near future. I'm proud of the content present on the channel. Looking back at some of these videos, I see how the lighting or the sound was quite poor, and I know that it would be beneficial for those to be refilmed. Yet, there are so many other videos planned for information that is desperately needed that refilming of some of these other videos that still has applicable content takes a back seat. Last to thank on my list, and most important, I want to thank my family. The channel originated in May of 2023, and we posted our first video of August during that summer. The channel was started with the encouragement and assistance of my family. My daughters, Auburn and Emma, have been instrumental to bring this information to you. Auburn has her own YouTube channel, and without her and Adam Legg, this channel would not have been brought to life. Auburn and Emma have worked tirelessly behind the scenes to help me produce the channel. They have listened to me patiently as I discuss the endless topics and ideas for videos. I utilize their expertise for filming, editing, and posting of the videos and podcasts. I owe a huge thanks to them as they patiently and continually train and retrain me. I mean, really, I struggle with the TV remote, so you can only imagine the difficulties that they have getting me to upload a video. So I want to acknowledge their efforts. I have learned so much bringing the content to you, and it's given me a greater appreciation for the changing world of technology. This information is available not only on YouTube, but on multiple podcast platforms. Without help and encouragement, I would not be successful in dealing with the challenges of uploading for podcasts or navigating the YouTube world. I have learned what it takes to edit and produce information and to get it uploaded to these various platforms, and I have tremendous respect for all those that do this and make it look so easy. I am motivated by the needs of others. As a clinician, there are many significant days throughout a person's life, with the first and the last being two of the most important days. Before we get here, there are months that our parents have to prepare for a birth event. Because of the advances in technology, we have better ability to forecast a patient's life expectancy, and healthcare has enjoyed tremendous advancements that now we can treat more illnesses than ever before, resulting in a longer and healthier life. We don't live forever, but we do have ample opportunity to manage our time well and to be better prepared for when our time becomes short. When we near the end of life and there's no curative measures that remain, there's still much that we can do. Managing symptoms, guiding discussions about choices and outcomes, as well as helping patients understand where they are on their health and life trajectory. It becomes more important for patients to know about their future, as does their decisions depend on what's going to happen with their quality of life, especially when our time becomes short. At that point, more than ever before, patients need assistance. And now more than ever before, people feel like they lack experience with end of life, resulting in a sense of being even more uncomfortable with death than ever before. Death in general is a taboo topic. Many times people tell me that they have never been present to witness a natural death. These circumstances have limited our experience with the death event and have deepened the mystic and added to our natural aversion. As the days of a person's life that are remaining draw to only a few, the amount of fear, dread, and panic that we may have are likely to increase. But when asked, many patients will voice that given their choice, they would want a natural death with support and having symptoms managed, and the location for that death would be in a home setting, not a hospital. During my career, I have worked across the entirety of the life spectrum, and I truly find it an honor to work with patients and their loved ones during the last chapter of life. I want information to be available for people to have at any time and in any format so that they can access information when they want it and to find the information that they need. I want it to be information in a format that's available and what works for them. This channel has been prepared to help share information and hopefully provide it in a less frightening environment so people can listen to it or listen to it again whenever they want, and they can turn it off when they want. So if there are suggestions that you have for the channel or needs that you have, a topic that you would like to learn about, please put it in a comment below and we'll get to it. Thank you for supporting me and for being a part of this channel, and I have more videos planned for you. Bye now.